Hello, everyone. We're here today discussing COVID-19 vaccines and what responses we're experiencing and witnessing within Black communities. We have some amazing folks around our virtual table today, each with our own views and experiences, and I would love to start off by just introducing some of the folks we have with us. We have with us Dr. Hyman Scott. Dr. Scott is the Clinical Research Director at Bridge HIV in the San Francisco Department of Public Health and Assistant Clinical Professor of Medicine at the University of California, San Francisco. He received his MD from Yale School of Medicine and completed his internal medicine residency, chief residency, infectious disease fellowship, and postdoctoral research training in the traineeship for AIDS prevention studies at UCSF, and has a particular interest in the epidemiology of HIV-related racial ethnic disparities among men who have sex with men and interventions to reduce these disparities. Also with us is the amazing Mayia Ogbebor. Mayia joins us from the San Francisco AIDS Foundation as Mayia is Manager of Community Health Programs. I want to say a big welcome as well to Robert Mitchell. Robert, thank you for joining us. Robert is a community advocate and a community advisory board member on Black Brothers Esteem Steering Committee at the San Francisco AIDS Foundation. Robert was also part of our 2020 ambassador program to AIDS Watch 2020. And joining us today, we also have Dr. Micah Lubensky. Micah is an applied social psychologist who has focused his career on addressing social justice issues for low-income communities of color. For 10 years, Micah was the community engagement manager with Black Brothers Esteem at the San Francisco AIDS Foundation. And Micah is currently the participant engagement director for the Pride Study, where he supports the research, experience, and retention of participants in this important national online study of LGBTQ holistic health, which you can find at pridestudy.org. And I'm Preston Vargas, and I'm here as the Director of Black Health with the San Francisco AIDS Foundation. And so we really just want to remind everybody and start off with, we've got two vaccines that are currently out here that are being rolled out. We've got the Pfizer BioNTech COVID-19 vaccine and Moderna's COVID-19 vaccine. And so, a lot of our reporting has kind of come up, the reporting's come up that Black folks have been dying of COVID at three times as high of a rate than white counterparts. And yet we're seeing that as the COVID vaccines are rolling out, that folks in Black communities are also accepting or having the vaccine administered at a much lower rate. And so just jumping kind of into the conversation, with the COVID vaccines rolling out, what are the responses we're witnessing in Black communities?
Well, what I'm finding is that a good majority of the Black community, they're very skeptical about this vaccine. There was a poll in November 2020 that said only 42% or suggested only 42% of the Black community is actually willing to take the vaccine. And I think it has a lot to do with our history, our medical history in this country, that we just can't trust that what they're giving us is actually safe for us. So I am finding that a lot of Black people are like, no, thank you. I'd rather not take this vaccine.
I've also been reading some research findings from like the CDC and been reported in The Guardian that just over 5% of Black folk are getting vaccinated in the places where they've been capturing race in the demographics of who's getting the vaccines. And for some of the articles I've been finding, the way that it's reporting is that there's a lot of concern about, how fast this is rolled out, and also the historical record we have with our mistrust and mistreatment by the medical industry and the medical research industry. And part of it is also just, a lot of Black folks need more time to ask questions answered. And we're not going to just jump into it without having more of our concerns addressed. And it's really important that when folks try to prioritize an equitable approach to getting the vaccines rolled out, that we leave space for Black community members to have questions and have their questions answered, because without answering our questions and letting us get our concerns addressed, we're just not going to do it. That's what it's looking like in the research I'm seeing.
Yeah, it's interesting with this piece on time and how quickly vaccines are rolled out. I mean, or the perception that it's being rolled out very quickly. You know, I was chatting with my mom and let her know, yeah, I'm going to get my vaccine. I'm getting my first injection. And that was her immediate response. Like, what? It's so soon. How do you know it's safe? And what's going on? And you know, it's not just an isolated incident with one family member that I've had. It's what I've heard again and again and again.
Yeah, I think that there's, to this point about there being this historical basis for really not necessarily trusting the medical establishment and some of the research that's been done that has not always been ethical. And I think that those that historical experience hasn't been, sort of, as I say, there haven't been enough additional experiences to be positive to compensate for that. And so I think that there's a lot of discussion about, you know, Tuskegee and a lot of the other atrocities that were done in the name of research, without the context that a lot of the research that's happening in subsequent to that has not always engaged these communities, has not always engaged the Black communities in a way to engender trust. Trust is not something that's just granted carte blanche. It's something that's earned, and a lot of the sweat equity to earn that trust has not been invested in the way that we would hope. So, you know, I get a lot of questions as a Black physician around vaccines, and you know, I've talked to a lot of my Black physician colleagues as well, who also share this skepticism about the vaccines. And so, it really is around, you know, who do you trust to give you the correct information, and what type of relationships have you established to have that trust established. And I think that's part of what we're seeing, is that there hasn't been the investment in building trust in the long term within these communities. And it's honestly, it's not surprising that if you show up in the middle of a pandemic with something that's brand new and you don't have this trust, that people are going to be a little skeptical. And I think that, you know, the surveys that were done in November, I'd be really interested to see what happens now that we do have data on 2 studies that show really high efficacy in preventing COVID infections, that this is not what we thought it might be. Like, this is a home run in terms of vaccine efficacy, and the short supply. Like, not everyone is gaining access to COVID vaccines. It's going to healthcare workers. And, you know, it's not just essential workers, it's healthcare workers, which is also, there's disparities there in who is working in the hospitals and in the positions that people are getting vaccinated. And so I think that there's still a lot of work to do. I do think that with education and discussion, that there's still a positive and a hope to this. I think that with all the concerns, you know, these vaccines COVID is way worse. And that's really where I end up, you know, with a lot of folks. And I think being sort of direct around that is helpful. Getting COVID is way worse than side effects that you might experience from the vaccines.
Can I say something to that, doctor? So COVID, in some people's opinion, is not way worse than death or having your body experimented on, right?
Mm-hmm.
And I think that is where we are as a people. Like, nobody wants COVID, of course.
Yeah.
But are we sure that what they're giving us is for this purpose? And I think that is where a lot of the folks in the Black community, where we kind of push back. Like, is this really the COVID vaccine? Because we know once upon a time in our history, we were told, we were given this to treat a particular illness or sickness, and it was something totally different. And so it's like.
So I guess my question to that question is, what would it take to have people feel comfortable that it is what is expected to be? And if is there an answer to that question? There might not be an answer. And I think that's to me, that's disheartening because we already know what's happening in the Black communities.
Yeah.
And we know how this vaccine. So I think thinking about how do we move, is there a way forward? And what does that way look like?
Yeah, I heard you mention sweat equity.
Well,
And I think like, one of the ways that we can build that is actually dipping in a little bit deeper into the historical experience. Like I think in some of our language, me as a medical, like in the medical field, I dance around, directly talking about things like the Tuskegee study. And when folks, 600 Black men were in that study, 399 who had syphilis were told they were receiving treatments.
Yes.
And they weren't receiving treatments. They were just being studied over a period of about 40 years, right? So that is the history that we're unpacking for folks in this discussion. That's part of the distrust there, part of this sweat equity we need to build in showing up and explaining and being here to start building trust again. Robert, I've seen you had started breaking as well.
Yes, I just wanted to share that I can appreciate everything that's been shared thus far. I share similar views, and most people that I've spoken to, I can say have expressed the same thing. I've heard extremes from one side all the way to the other, and the concerns are real. The struggle is quite real. I think you can add into that a lot of mistrust that comes from, let's say, just the judicial systems and the police brutality and the way we're treated as a people, and all the different oppressions and the oppressions that we have to face as a whole has just sort of beat us down. We have little or no trust, or we're very weary in that respect. However, I have seen within my own family, I've spoken to a few members that have already taken the the vaccine, and they're all encouraging others to do it. It seems to be sort of building some momentum. So I found that somewhat encouraging because I'm considering it myself. I have personal concerns regarding my personal health, and everything. And I'd like to speak to a doctor pertaining to my own specific, situations. I've had open heart surgery. I have a sleep disorder that is driven by a neurological disorder, sleep apnea. And, I want to get some real good feedback about what would be the risk, of taking a vaccine that has been known to have side effects like Bell's palsy and Erb's palsy, if I'm pronouncing those correctly. So I'm working on it, but I am getting encouragement and support on the side towards the vaccine. And I also reason that I've taken many vaccines before, not even being aware as a child, grandmother took me to the clinic and to the hospital and doctor's office, and I got vaccines all along for various reasons and have had no problems. However, I don't think they were as brand new, But anyway, I can appreciate the concerns on either side. And that's why I'm here today, to share and get an exchange and hopefully learn and be able to, lend support to others. I've also heard from persons that have been infected with COVID that it is so serious. And they highly recommend a vaccine if you can get it. So I'm open-minded.
So Robert, what you're touching on for me is like the intersectional nature of the challenge, right? So if I'm thinking about violence against Black people by police, if I'm thinking about judicial systems that are targeted against Black folks, if I'm thinking of a socioeconomic system that has been structured to keep Black folks at bottom rungs or just at poverty level or below poverty level, thinking about access to healthcare that's not as accessible because of where I live in a Black neighborhood, all of these things intersect on my choice of whether or not I'm going to trust a system and people who are working in a system that has not been designed to benefit me as a Black person or protect me or just, at least provide an equal chance. As a healthcare provider, what I can do is, I've taken the vaccine, I'm showing up and saying like, for me and my condition and my health, this is it's working for me, right? But what do community-based organizations need to do in order to be the trusting voice that our communities, will listen to? What is it that we can do so when we say this is what's in the vaccine, folks can trust that it's an actual, real, effective vaccine for COVID-19 and not anything nefarious?
I want to circle back to what Dr. Scott was saying about, sweat equity and what we need to do to earn trust. Besides the super famous Tuskegee study, there's been multiple incidents and events through medical history about how Black folks are treated worse or just completely abysmally. And then it continues even in just the interpersonal relationships people have with their doctors, where they're not believed when Black patients go to doctors and ask for medicines. They're not believed that they're in the same level of pain. Infant mortality and mother mortality in delivery for Black mothers is more than twice that for white women. There's lots of ways in which the medical systems and establishment just do not support or even just undermine Black people. And so one of the ways that I think these community-based organizations and medical researchers and medical providers like Dr. Scott can demonstrate the trust is by not reproducing these same problems, these same dynamics that a lot of folks have with their doctors about just not being believed that they're in pain or not being believed about the severity of their issues. And then also trying to take more time to hear questions and to legitimately, to validate all questions that come in, and then take the time to explain, here's the reasons why we know the science works. Here's what the science is. Here's what we're doing. Here's how we'll demonstrate to you the benefits of taking this vaccine. And not just the medical benefits, but there will also be social benefits. Like, that at some point we'll talk about having this vaccine passport. Like, you've been vaccinated, therefore you can do things that people who are unvaccinated cannot. And that's going to have, additional ways of leaving Black community behind. And so we've got to think about these implications and make sure we're able to communicate them in ways that are not condescending and talking down, but listen to people, listen to their concerns, answering questions and not reproducing the same dynamics that a lot of Black folks are seeing in their lives.
I agree with that. I appreciate that very much, Micah. If I may be allowed to speak on that. I think what might be also a useful tool maybe is to offer maybe weekly workshops that sort of explain the science, and the step-by-step process to both create the vaccines and apply them and how they affect our systems and things of that nature, and give some realistic data. If this is offered on a level where, it might be over our heads generally, but if it can be sort of broken down where a person like myself, a layman, could grasp it and appreciate it, well, then maybe I'll go home and let it sort of sink in and do some personal research if I choose, and be more apt to make a decision, an informed decision within a short amount of time. If this workshop is offered maybe once a week, it allows me to say, okay, next week I can set aside time to come and learn all I can learn about this vaccine. Hopefully in a week or so after that, I've made up my mind to take it, or to be, open to taking it or learning more or sharing it with others. Knowledge is power. So I think that might be a good way to help folks.
I think it also helps when we have, organizations like I think it's called the National Medical Association. And you can correct me if I'm wrong, Hyman.
Mm-hmm. Yeah, that's
Dr.
correct.
Scott. But there are organizations of Black medical professionals who actually the organization started when the American Medical Association wouldn't admit Black physicians. So they started their own association and been building reputation nationally for over 100 years, and other Black nursing associations and things and groups like that, who can speak to the concerns that community members have, because a lot of folks aren't lucky enough to have a Black physician like Dr. Scott. I'm lucky enough to have a Black medical provider, but so many people I know in Oakland who are Black folks in Oakland don't have one, and I'm lucky to get one at my Kaiser facility in Oakland. But, to be able to talk to Black medical professionals who can answer the questions for them about, what's really behind this vaccine, what's in it, what can the side effects be? Could I really get can I get COVID from the vaccine? No, you can't, but people can ask those questions, have their questions taken seriously, and then can have a time to really, like Robert says, think about these things and have the questions answered. I think that's really important to build trust and to build, believability in the community that this is more than just an experiment potentially. Like, Maya brings up a really good point. People are concerned. What is this really? Is this really what they say it is? And we need to have folks be able to ask these questions and have people they can trust answer them.
Yeah, I don't want to water that down. Actually, I was in a really intense discussion with a few folks earlier this week, and there were questions about if there were tracking devices, nano tracking devices inside of the vaccine to track Black people. Is this, something targeting Black people in order to kill them? And these are folks who, level-headed folks that I'm hanging out with, and it's not beyond the realm of possibility, because folks, I personally don't know all the steps and procedures to making a vaccine. I've learned a lot through this process. I've learned a lot through watching UCSF weekly rounds, and I've immersed myself into. I've had that duty and responsibility to kind of have to. But maybe this is a moment too to just tease out some of those myths, like what is in the vaccine? Can it give folks COVID? Tracking devices, is that possible in a vaccine? And I don't want to, it's in some ways like tongue in cheek, but in some ways it's really serious for folks about what is in there. Is this an overly fast way to produce a vaccine? Maybe this is the normal procedure of how vaccines get produced.
You know what? I want to bring like Christianity into this a little bit. And the reason why I want to do that is because I know, especially, it's a huge, Black people are highly Christian, or at least have Christian roots. And I really like what Preston brought up about the tracking device, because I often think about that as well. I remember back in the day, my grandma used to say that it'll come a time in the last day where you would have to take this kind of mark. And if you don't take this kind of mark, you won't be able to buy or sell. And when you bring up the whole COVID passport, it kind of reminds me of those words so long ago that grandmama told me from a very biblical point of view. And it's like, okay, is it really going to be a choice to take this vaccine? Especially if you're not able to travel if you don't have it, right? So right there, you're already being limited on how you can move throughout this world if you choose not to take this vaccine. And so that is one of my concerns. Like, really, what is this? What is it? Is it just a vaccine? I'm not so convinced. Or is there some other motive behind this?
I think that picks up on two issues for me. One is the importance of faith-based integration with our social support systems. And for many folks in Black communities, faith-based organizations have been there to provide everything from food to housing to support to solidarity. And how do we work with faith-based organizations in partnership when we're doing things like offering vaccines? Is that another place where we need to listen and need to step back from a position of authority and work in a position of partnership? And then the other part is, when we're talking about limiting choice, for me as a Black person and a Black man, that immediately gets my hackles up. So, I think it's part of the discussion that warrants more teasing out too, where our choices lie.
And I also think it's important to balance out, because I think that there's a lot of discussion around some of these questions about what's in the vaccines, and not always a balanced explanation of those in a way that's accessible and available. And so I think that there were two questions that I could probably speak a little to. I think one of them was really around, do we know what's in these vaccines, and isn't this very fast? Isn't this process very fast? And so, and both the BioNTech, Pfizer, and the Moderna vaccines are a new platform. They're using a messenger RNA that is sort of encapsulated in this lipid or fat that allows it to get into the cells. And it's the first vaccine that's been developed and used for that. What I generally try to remind people of is, like, if you look at your cell phone, the cell phone that you have today is not a cell phone if you had one 20 years ago, right? It's a different process. Technology has changed, science has advanced, and we should take advantage of the advancements and all the things that we've learned. The U.S. invests way more than any other country in science and the NIH and other places, and so this is a new platform that has been developed and is being used for this vaccine. And it happened to happen during a pandemic. They're also, for example, developing HIV vaccines and other types of vaccines using this platform. And so they contain mRNA, which is a small instructions to make a piece of the protein that's on the coronavirus called the spike protein, which is what the immune system needs to respond to. And so it sort of instructs the muscle cells where they do the injection to make those little proteins. It gets shown to the immune system, and the immune system develops the army of antibodies to be ready when somebody gets exposed to COVID. And then once that army is sort of developed in the body, then there's the vaccine gets sort of degraded. It's a foreign piece. It's not from your body, so your body takes care of and destroys it, and it doesn't stay in your body. The response from your immune system does, but there are no tracking devices as part of this. This is instructions to create proteins that trigger your body to respond to the virus if you get exposed. And that's the strategy for all vaccines. I think, the vaccine passport is going to be a very tricky discussion. I think that if we look at what happens in schools, for example, we require vaccinations for children before they come into schools for, highly contagious infections that can potentially be spread. So I think that there will probably be some discussions, particularly around international travel, around potentially requiring either proof of vaccination or proof of negative test. But it is going to be a controversial sort of step of whether you require it or not. I think the other place is in essential workplaces like hospitals and other healthcare settings. This year, flu vaccination was required. And so there is a possibility that COVID vaccination might be required as well as potentially in other settings. I also think that it's, there's a lot of discussions around the schools and like how we get our schools to open up, and the potential damage that we're doing to not only, to current generations, but potentially future generations if the schools remain closed. And it is a lot of the parochial and private schools are open already. And it's a lot of the public schools where a lot of our Black children are receiving their education that are remaining closed. And so I think there's a lot of discussions around that piece. But I do think that there is a lot of, it moves very fast. And I think that as a result of that moving fast, there's a lot of lost opportunities to communicate about what's happening and what it is and what it isn't, and allowing people to ask questions and express concerns, and then have an open dialogue about what information is out there.
What I've seen a lot throughout this past year of sheltering in place and COVID-19 is the responses that Black communities have had, galvanizing, movements that have evolved, propelled, and uplifted Black communities. And I'm wondering, what I'm hearing now is like, these are moments where we can slow down and ask more questions and have those questions answered, we can break down how the science, but we can also address things like our personal choice, our movement, our freedoms. But what else can Black communities and Black people use this moment for? If we are here where everything is coming up around these COVID-19 vaccinations and vaccines, from our histories to our futures, what do we use the moment for?
I'll say that we're pretty lucky that this moment is here because we have a commitment to equity from our current president, and we have a vice president who's also demonstrated her commitment to African American community support and equity, being a member of our community. And we have this consciousness, at least for the moment, amongst communities who are not African American, with the current rotation in the Black Lives Matter movement. A lot of us in the Black community, Black Lives Matter never stopped being a part of our lives, but when George Floyd was murdered in last summer, it came back to prominence in other communities. And so that remains to some degree in prominence. And that, I think, filters into why our current president, Biden, has like one of his first executive orders was in making sure we have equity in lots of different places in American politics. And so we have a broader platform to advocate for justice issues in many ways, in many places. Now, ultimately, it's like, show us the receipts. Okay, so if people say this is what's going to happen, let us, show me what you're really going to do about it. And so, but while this platform is here, I think we have an opportunity to push for many things. Like even the article I was reading about the CDC finding that a little bit more than 5% of Black folks have received the vaccines, and there's a push for equity, for making sure these vaccines are rolled out equitably. And so there's a push for standards in how all the states are collecting demographics on who's getting the vaccine. There are these pushes. So while the iron is hot, let's strike and let's get some other things that we need. There's a lot of room for getting things that we need, because we have a lot of things we need.
And I think this is an opportunity to push broadly for equity across health. Like, we're talking about COVID-19, but HIV, diabetes, hypertension, stroke. I mean, the list is extraordinarily long about where these inequities lie. And a lot of the inequities are driven by foundational things that hopefully we can use this moment to move the needle towards equity, and then that will hopefully pay dividends. And we would need to see the receipts, as Micah said, around ensuring that some of these foundational things are available, like what facilities are in our communities, what access do individuals have, insurance and all the attacks on the ACA. I think that there are a lot of things that this opportunity would allow from a health perspective and a health justice perspective to move the needle on beyond COVID.
Yes, I can agree with that myself. I think we have established quite a platform in our efforts of eliminating HIV that causes AIDS. It has drawn attention to and interlinks, just as you have already mentioned. It has direct connections to our health and well-being, and a balance among other ailments, diabetes and hypertension and heart disease and mental health and everything else. So this might be the perfect opportunity to get people to appreciate how knowledge and statistics and data and everything has come into play to help to make for a better life, to help to better manage, these various conditions. Even more so, we would want to work together to sort of eradicate or manage this problem of COVID, because it is far outreaching all the rest of the ailments together, I believe. So I guess what I'm saying is, I would think that would encourage people to come together and with an open mind and actually study and find a way to find answers and to further educate and support others. As we mentioned before, the stigmas, what's the word I'm looking for? The rumors, the stigmas, the superstitions, the myths, those have a tendency to grow. They blow up out of control with seemingly little or no effort. And it's a much harder task to share the truth, and to get accurate knowledge out there. So I think if we could maybe approach religious leaders and offer this type of information and support and resource, that might be a very good way to reach your common peoples, to someone that they trust, such as their religious leaders or any kind of leader, in any kind of category. If you could sort of focus on giving this information to them and show the background that we have of bringing other information from the past and other resources together to handle these problems, we invite them to join us in this endeavor, to encourage people and to learn more, all there is to know about this problem and the management of it.
Friends, I hate to be the person that sucks on this panel, but I feel like I just have to keep it real. I'm one of those Black people that I'm not down with the vaccine at all. I feel like the medical community has really failed us as Black people, and I think that they still continue to fail us. I can even share a personal experience when I went to Kaiser and I was really, really sick. And the doctor said, "Oh, yo, you have pneumonia," right? And so then she called me and told me I had pneumonia. Prescribed me antibiotics. I'm on the antibiotics for said time. I ran out. I'm even sicker than I was when I first seen the doctor. I went to another hospital. I was admitted and I spent 10 days in the hospital. So sick, I couldn't even breathe on my own. The day that I was released from the hospital, Kaiser called me and said, "Oh, the doctor found something weird in your test results. We would like you to come in." Well, I would have been dead. That's how sick I was if I would have waited 10 days for that callback. Those are the kind of things that our people are experiencing. I even had a friend, well, not a friend, my cousin's friend, young man on Medi-Cal, had sickle cell. He died because of all of this and that Medi-Cal puts people through before they can get the actual treatment that they need. That's what I'm saying. Like, we are not being taken care of medically. We're not getting information that we need to keep ourselves safe and protected. I once did, maybe a year and a half ago, I was really into doing this PrEP campaign. And what I found out is the Black community, especially the heterosexual Black community, knows nothing about PrEP. Why? When this is affecting the Black community at such a huge rate, why don't we know about PrEP? And then I was told, well, like if it's the gay community, it's kind of out there, right? But when it comes to the heterosexual community, it's not out there, not like that. And when I've talked to heterosexual people, like, yeah, I've seen billboards and advertising for PrEP, but I didn't think it was for me. That's what I'm talking about. Like, we're not getting the education that we need. We're not being taken care of like we need to be taken care of by the medical industry. That's why Black people are like, no, thank you. I'm cool. I'll continue to wear my mask. I'll continue to social distance. I'll continue to wash my hands like I was told to wash my hands, because I don't trust what this doctor says to me. I don't trust that they're giving me accurate information. And I don't trust that Black lives really matter. And that's the bottom line. That's
Maya,
why.
I don't think you suck in this conversation. In fact, I think it brings more life into this conversation because, one of the reasons why I was hoping that you would join this conversation.
Thank you, Preston.
I've said similar things about when I've advised on boards about prep and prep education among cis Black women, and who are foundation of our communities, and the information that's not out there. But for me, like, you bringing this in actually goes to like the question of what we are not doing and could be doing better, right? So I don't think it squelches the conversation. I think it actually leaves it open for us to continue, and maybe not continue in this space, but clearly continue in the work that we're doing and what we're bringing to community and how community responds with us. Because for many of us, we may not feel that Black lives do matter to everyone, right? But for those of us who are in these positions of actual or perceived power in these industries, we can actually be making some of the headway and the changes to get that information out there, to set up what Robert asked for in terms of, these regular downloads of how vaccines are created and work. But not only that, but to link people up with, if it need be, the physicians who are actually in the establishments that are actually willing to listen and serve Black folks in the capacity that they need.
Sure.
And I'd just like to pick up on this sort of like thinking about, so my mother is also very distrustful of the health profession. And whenever she goes to her doctor, the second thing she says is, I need to release information from my son, who's a physician. And she gets treated very differently as a result of that. And so it's and that is her strategy, and it works for her. Not everyone has somebody who they can do that with and get that type of connection. But I am interested to think about, like, what does a way forward look like that is affirming, that is positive? Because it's, what you described is beyond COVID. And this is kind of where I was saying, I think that we might have this opportunity to just, to improve things beyond COVID, because I do think that there are a lot of other things that are also putting Black lives at risk that could be addressed in this process. And not that we have to have the answers, but like, what does it look like for this to be positive and successful in terms of experiences, in terms of really showing that Black lives matter actively?
Yeah.
And can I add, I'm sorry to jump in, but can I also add the reason why it's so important that we figure out how we move forward, is that there's a lot of folks who can't just stay at home and work from home. Yeah. So many people who are emergency workers and frontline workers, and who are transportation or machinery or growing food or processing food, don't have a choice. And so, like, I have 5 cousins in the hospital right now with COVID-19 on respirators, 5. So, and then I have another cousin who's taking care of them. Their brother is taking care of them. And so she's a retired nurse, but she doesn't have a choice, right? So what do we do to make sure that our members of our communities who don't have choices can be more protected or have less risk? Because we see these numbers, we're dying. We're dying at these disproportionate numbers. Black folks, and also Latino, Latina, Latinx, and Native American folks and API folks. We're dying at these disproportionate numbers. We need to do something. So this is one of the reasons why I care, to know what we can do to move forward.
Yeah, and just for context, I think, what we've seen happen in some countries, like in Italy, there's like a whole generation of grandparents who are just gone. And so I think that there are real consequences to COVID spreading through communities unchecked. And so I think to echo the questions about, like, how do we keep our communities safe? And what's the best strategy to do that?
One of the strategies I've heard over and over again is to not dismiss or downplay these concerns that Black folks have and people in Black communities have, but to take them as real and as factual as somebody's lived experience. And then for us to find ways to work around that, for us to find ways to mitigate some of the damage, and for other health practitioners as well and healthcare providers to find ways to mitigate some of the damage and build some of the trust as well. We would probably have all so much more to say. But for now, I do want to thank you, everyone, for being with us and starting off this conversation. I know as we share this out with our communities that it'll continue to spark more questions than answers. But I think that's great, as it helps us problematize to keep looking for what is not working here, and so that we can try new and novel approaches to engaging with our folks, changing what the healthcare field is looking like for people, and bringing in some health justice. So I do want to thank Dr. Hyman Scott, Mayia Ogbebor, Robert Mitchell, and Dr. Micah Lubensky. Thank you so much for being with us today and offering your insight and your expertise.
Thank you for inviting me.
Thank you all.
Everybody.
Thanks for having me.
It was a
Appreciate
pleasure.
you very much, all of you.
Thank you.
All right.
Keep up the great work, all of you.